Here are the biggest mistakes I see caregivers make. In this video, I'm going to describe what a caregiver should and should not do to help their loved one. Just to be clear, I know how thankless of a job it can be to be a caregiver and how hard it can be and how lonely it can be. I know you are doing your best, and this video is just meant to help you. Generally speaking, in this video, I am talking about the patient who is nearing the end of their life, either on hospice or just because they're elderly, palliative care, some kind of life-limiting illness. There's something like that going on. So number one, do not force feed. Do not make them eat or drink. I have seen countless people, because they are loving someone so much, force people to eat, even using a syringe to get liquid and food in their mouth. This is not needed, one, and also dangerous. This is dangerous. So the number one thing I see in elderly people or people who are on hospice who are having issues eating is aspiration pneumonia. Aspiration pneumonia is something that happens specifically with usually dementia patients or Alzheimer's patients because they start losing their ability to swallow. But families, out of love, think they have to eat, so they try to make them eat, and then their loved one aspirates. So if you don't know what aspiration is, we have an esophagus. So when we eat and we swallow, and the food goes into our esophagus down to our stomach. But near the esophagus is the trachea, which goes into the lungs. So when you are getting towards the end of life, or you're just very elderly and these muscles are getting weak, it can be very easy to have liquid or food go down the wrong pipe. When you're forcing someone who's having a really difficult time eating and chewing and swallowing, and they either forget how to do it, or their brain is not telling them to swallow, or these muscles are really weak, when you force that, it increases their risk exponentially to aspirate. And when you get little particles, even if it's just a little tiny bit of food or water in your lungs, that can eventually turn into pneumonia, which can be really scary and really serious if you are in a population like the elderly or someone with a terminal illness. Now that I say don't force feed them, what can you do? What do you do? So first things first, if they are on hospice, you don't have to do anything. You don't force them. First off, you just try, offer them all their favorite things, all the things you think they might want, and you're gonna be able to tell that some days they will take it and some days they won't. Some days they'll eat breakfast, but not lunch, but then eat dinner again. So my suggestion is always offer, and you're gonna have good days and bad days. If they're not on hospice and you're truly concerned with their nutritional status, of course, always talk to their doctor, work with their doctor to see what they think, if they can do anything to help with that. Aspiration precautions. So there are things you can do to help. If you are feeding them and you can tell they can do it, but it's becoming difficult, aspiration precautions are things you can do to help decrease the chance of them aspirating. A few of those things are having them sit up. So making sure they're at a 90 degree. Now, if they're a little slumped, it's okay. But what I mean is don't serve them food lying down. That can increase their risk for aspiration. The first thing people start choking on is liquid. People think it's the other way around, but no. The first thing you're gonna start noticing is if they start drinking something and then they start coughing. Or like they're clearing their throat. That's a good sign. That means they have a strong enough cough to protect their airway. But that is a sign that they may be having difficulty swallowing. So if that is happening, you want to talk to your hospice company, let them know, or talk to your doctor, because they can start something called like a thickener, something to make the liquid a little more thicker so it's easier for them to swallow. Lastly, don't have a bunch of distractions. So if they are eating, just allow them to focus only on that. And again, never force. So if they are not doing well and they don't want it, or they're not swallowing the food, don't force it. Another thing not to do as a caregiver is don't force a diet. Now, this is specific to hospice patients or anyone getting near the end of their life. Don't force them to stay on that low sodium diet. Now, there are circumstances where yes, a low sodium diet would be best, or if they're diabetic, but if they truly are end of life, in my opinion and hospice's opinion, give them what they want. Give them what they want. Even if it is liquor and sugar, that's okay. Give them what they want. Or cigarettes. If that's what they want, that's what they want, as long as they're not on oxygen. Don't force or fight them to take medications. Now, some medications that I will, personally as a hospice nurse, that I'll try to get people to take is only if those medications are going to help with symptoms, which is very few and far between. You know, a pain medicine or a medicine that's going to help with seizures, things like that. But still, at the end of the day, they are the boss. If they don't want to take stuff, they don't have to. So don't force it. Now, I know it can be difficult with like dementia patients, Alzheimer's patients, because they really need the medication, possibly, but because of their cognitive issues, it's hard to make them take it. In those situations, know that you're not doing anything wrong. It is truly just that hard. I think some people think, how does everyone do this? They don't. It's a difficult situation. And some days you're gonna notice that your loved one's able to take the meds and some days they're not. You can always try to crush them up if they're meds that can be crushed. Put them in something they like a pudding or an applesauce, something sweet, but just don't stress yourself out to the point that you get angry. Right? So try, and if you can't, you can't. And also, if you're really having these issues and you're worried about it and they're on hospice, call your hospice company. Talk to them about it. See if there's other things we can do. This is an important one. Do not force them to get up. They have to eat and they have to get up and go to the dinner table. Now, yes, that's good. And we know sometimes people don't want to do things that are good for them. So there is a fine balance here. But specifically when people are on hospice or getting towards the end of life, a lot of times they're trying to listen to their body. And their body is saying, hey, I want to sleep. I want to sleep, or I'm not strong enough to get up. And forcing people up to the bathroom or to the shower or to the kitchen table can cause falls. And falls are one of the number one things that really take people down, specifically when they're elderly or if they're really ill. And when someone falls, it's really hard to come back from that, especially if they break their hip or break a bone or anything like that. So you always want to ride that fine line of, do we get them up because that makes them feel better, or do we allow them to sleep and let their body be the guide? I always err for let their body be the guide, especially if they're on hospice. Now, of course, if they're lying in bed and you know they're wet and they need to be changed and they're saying, no, that's a different story. You have to always make sure they're clean. So if they're clean and they want to keep laying down, allow them to do it. And again, if we are going to feed them in bed because they're still hungry or they do want to eat but they don't want to get out of bed, make sure their head of bed is up 90 degrees. Also, if your loved one isn't on hospice, they aren't end of life, but they are still having a hard time getting up, but they want to still, but they're weak, you can always talk to your doctor about trying to get physical therapy in the home, occupational therapy in the home, something like that to help them navigate their new normal. If they still want to get up and do things, but they're too weak or they don't know how because now they need a walker, you can always get a physical therapist in there to kind of help them figure out how to do it with their newfound lack of strength. Okay, last but not least at all. If you're a caregiver, I see this mistake all the time. Do not do it. Do not be hard on yourself. Caregivers are so hard on themselves. They never think they're doing enough. They always think they're doing a bad job. They feel alone. They feel overwhelmed. There's so many things they are probably feeling. There's probably anger, some resentment, all the things. You are doing the best you can. This is a difficult situation. Again, I always liken it to like when parents have two like newborn babies and they're like, how's everyone doing this? This is so hard. I don't know how we're keeping this together. I'm barely treading water here. That is how it feels to care for someone, especially at the end of their life or if they have some kind of difficult disease like dementia or Alzheimer's. So please don't be hard on yourself. You are doing a good job. If you feel overwhelmed, ask for help. Now is the time to ask for help. Who do you go to? Anyone. Just kidding. No, you go to your friends, family, neighbors, community. You can try to schedule an appointment with the doctor of your loved one to say, hey, I need help. I cannot keep doing this, and see what they can offer you. Know you're not alone and know you're doing a good job.